just standing up here brings the room to a quiet. Okay, so I'd like to acknowledge the traditional owners of the land, the Gadigal people of the Eora Nation. Pay my respects to elders past, present, and emerging. Great, so welcome everyone. Welcome everyone who wasn't here yesterday. And I guess a slightly more genuine welcome to those who came back from yesterday. This session is on policing. So I'm just going to introduce the first speaker, Inspector Greg Donaldson.
And Sharon Bicknell.
Oh, sorry.
That's okay. Oh. Have we got the... Yes.
The slides
Are they not loaded? Thank you. That's great. Thanks everyone. Lovely to be here today. I'm going to kick off and then hand over to Greg. But firstly, I'd like to acknowledge the traditional custodians of the lands that we're on today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present, and emerging as well. So I'm coming here from Revenue New South Wales. So I'm sure you all know Revenue New South Wales is the agency that administers fines in the state of New South Wales, and we do this for over 200 organisations, including New South Wales Police, Transport, local councils, even hospitals and universities and other government agencies such as councils. We have three different customer groups at Revenue New South Wales. We think about one group, customers who pay on time. This is around 79% of people receive their fines in the mail and pay. And then we have this second group who do not resolve their fines on time. And we break these up into the customers who can afford to pay but don't, and the customers who can't afford to pay. So these customers are in hardship. And a lot of the work we do at Revenue in fines and debt is actually dedicated to these two groups here. And I'm really coming to you from the hardship support program. So a lot of my focus is on projects and design and strategy in the fine space around those customers who can't afford to pay and how we can assist them. And that's because we know that the fine system can have a disproportionate impact on people experiencing hardship. So we really care very deeply about a number of issues that lead to this. So, we think about financial, not just financial hardship, but we also think about digital exclusion, mental health issues, and other exclusionary factors that can influence someone's ability to pay, but also the impact that a fine can have on their lives and the knock-on effect that can have as well. So we're running a number of projects at the moment. We're doing a lot in the space of youth in out-of-home care. We're looking at responding to the fine system around financial abuse as well, and the response that we have to protecting people who are under coercive control. In 2020, we actually started the hardship support program, and a number of initiatives under that, from legislation change through to those projects that I was talking to you about as well. And one of the big questions that we had at the time and that we were talking quite a lot about was, what if we could start focusing on rewarding positive behaviour instead of the fine? And that's where we started a new partnership and heard from this man, Inspector Greg Donaldson. So I'm going to pass over to him and he'll tell you a little bit about what happened next.
Hi everybody, thanks very much for allowing me to come here and speak to you today. I'm from the Highway Patrol. I'm one of those nasty police who drive around and create customers for the people at Revenue, but we're not like that at all, to be honest. So a little bit about me, and maybe that explains why I got into this diversion space in the first place. So I've had 34 years in the New South Wales Police Force. 18 of that was as the Highway Patrol Sergeant at Mount Druitt. So Mount Druitt, everybody knows Mount Druitt. It's probably one of the most violent policing communities that we have in Australia. I love it. I couldn't imagine being a policeman anywhere else, although I got promoted and they moved me. But anyway, so Mount Druitt is a very low socio-economic area. And we issued there about 800 child restraint tickets a year, which was double the next closest to a policing command across New South Wales. Now, at the same time we were doing that, there was kids that were losing their life across New South Wales and Australia through not being restrained properly. So something was going wrong, right? Here we were detecting all these child restraint offences, yet out of the 31 child passengers who were killed on New South Wales roads in the 10 years before that, half of those lives could have been saved should they have been optimally restrained. Most of those drivers were kids from low socioeconomic families. So children in the lowest socioeconomic areas of the state were 5 times more likely to be killed in a crash than those in the highest socioeconomic areas. So if you're a kid growing up in Mount Druitt, you're 5 times more likely to be killed in a car crash than if you grew up in the northern beaches of Sydney. Rural areas increase this. Aboriginal children accounted for less than 5% of our population, but 20% of those fatalities. And Highway Patrol were giving tickets to their families when they couldn't even afford a car seat. The notices were being issued to some of our most vulnerable people: low education, low income, drugs and alcohol, DV victims, families from culturally and linguistically diverse backgrounds, and our Aboriginal communities. So I found that with working with these low socioeconomic areas, that penalty notices had a very disproportionate effect on those people. If most of the people in this room got a $300 fine and 2 points from the licence, they'd put it on their credit card and move on. It means the difference of feeding your family for some of the families that I deal with. People with higher incomes can afford better cars, better quality car seats. They shop in areas that have free fitting for their car seats and not at Kmart, who don't have that service. So I looked at some of the existing child restraint programs that we had, and many of them were only attended by people who were already invested in their children's safety, and they weren't our customers. They were people who were coming back every 6 months to make sure that the heights were adjusted as their kids grew. They were people who had really good access to education and health. Not the people that we were giving tickets to. So we started working on programs more on education and supplying seats to communities through fundraising, some money from local community groups and some local businesses. And initially we started a program specifically for Aboriginal communities, and we supplied about 900 seats across New South Wales through a network of midwives and healthcare workers and transport workers and children and child support groups. Still, it wasn't enough. These programs were very labour intensive and they weren't sustainable, and we didn't have the reach. Moving forward to 2020, sitting on the Aboriginal Interagency Committee for driver licensing, I met our friends at Revenue, the hardship support team, and I saw that our goals aligned. Road safety. And road safety should not be about punishing drivers, it should be about making them safer. The children in these cars were not safe. The highway patrolman would stop them on the side of the road, give mum or dad or auntie or uncle a ticket and drive away. Is that child any safer? I would say no. We really haven't achieved a road safety outcome. We haven't addressed the issue, and that's keeping these kids safe and reducing some of those fatalities. We came up with a diversion program. It was a proof of concept because not everybody thought that this would work. Not every highway patrol officer wanted to give somebody a caution. And can I explain to you why? When you go to a crash and that child has not been restrained optimally, has been shredded by the windscreen when they've been ejected from the motor vehicle, and it's the highway patrol officer, you have to pick that child up, put them in a little bag, then giving a ticket out to the next person that you see doing the same thing is very easy. So it wasn't very easy for me to get all of my staff, all of the officers across New South Wales to do this, because we have a job in policing, and that is we're the final point of call. There has to be always a deterrent effect for our road rules, because if at the end of the day the policeman wasn't there to give you a fine, then the people would just be more disobedient if there was no consequences for poor actions. So I now work in the Macarthur area of southwest Sydney, Camden, Campbelltown area, and the process that we came up to is we would stop a motorist who was committing an offence, and in the first instance, rather than giving them a ticket, we would give them some time frames to get themselves a compliant car seat, have it professionally installed, and if they did that within the prescribed time, then they would be given a caution for this. We did this over a period of about 12 months. And in some areas they were funded by Revenue, who gave us vouchers to have them fitted, and in other areas the customer had to pay for it themselves. And we have a little bit of a film clip here just to give you a bit of a rundown on it.
They are the most precious cargo you can carry in a vehicle, but police are concerned about the amount of children put in danger by not properly installed car seats. It is the driving force of a new program already proving successful, with motorist fines waived if they have child restraints fitted by a professional.
Careening through a red light, this car slams into another vehicle carrying a family of 6. Inside, 4 girls were saved from serious injury by their car seats.
If the seats were not properly installed, the situation can be very different, because the way the car damaged, lucky no one even moved from the seats.
Before the accident, Mohammed had been pulled over by police for not having child restraints correctly installed. Instead of a hefty fine and the loss of demerit points, he was offered a diversion program.
We give them the opportunity to get themselves a compliant car seat, have it installed by a professional, and if they do that within a 21-day period, we give them a caution rather than giving them a fine.
It's a state government initiative to drive down car seat-related offences detected all too often. In a 10-minute period along this Minto road, 2 drivers were pulled up by police.
And I guess for us, we didn't know that wasn't correct, I suppose.
The diversion program an opportunity to educate, not just penalise parents.
But they don't realise in an event of an accident, that child now is propelled forward into the front seat of whether it be the driver or the passenger side, and these lead to serious injuries.
In less than 12 months, almost 60 drivers have taken advantage of the diversion program trialled in 5 local government areas. The hope is now to roll the initiative out across the state.
It's much more important to be involved in saving lives than giving people fines.
Samara Gardner for 10 News First.
So the gentleman in that video was detected by one of my constables driving with 2 unrestrained children in the car. The seats weren't compliant and he had no idea about how to install them. So Sam from Little's car seat turned up. The driver bought himself 2 car seats using the money that he would have spent on $750 worth of fines. And those children's lives were saved as a result. So that's our program and how it works. That was the proof of concept. 84 drivers took up the service. That was a 87% compliance rate. Very interestingly, we ran a site in Dubbo. They had a 100% compliance rate within 2 days of being given the option, and they had to pay for it. So whereas in Macarthur, we had a less compliance rate, and we were offering the service for free. So I think the main drivers for the drivers is the safety of their children and not the cost. And certainly they can use that as the funding that they would normally use using a seat for that service. So that's it. You're next.
So Revenue is really proud to be partnered with Greg, and as Greg said, we contributed some vouchers for the metro area to see how that would stand up, but also, assisted in terms of documenting and data capture. But with this particular success, we were really happy to see this level of behaviour change and that we were getting some safety outcomes here. But with this success, a new challenge emerges. So we wanted to think about how to scale this up statewide, and with what Greg was saying around that enforcement sort of mentality of police as well, understandably, but also the manual administration of the diversion, we knew that Revenue needed to step in and to take on this sort of statewide view. So we started a 10-week design project using HCD, human-centered design, and really the vision for the program and the diversion was to give our customers a chance to show changed behaviour and to really increase our confidence that the safety issue has resolved. We also needed it to be easy for our customers to use, especially given we knew this fine was hitting customers who are more disadvantaged than others. So we we really used prototypes to test a number of the hypotheses we had about how this diversion could work. So this is what we mean by a design-led project. We needed to make it a revenue statewide project, we needed to understand whether people, learn whether people would even understand the concept of a diversion, whether they'd know what to do and be able to follow the steps, especially given there wouldn't be a roadside conversation with a police officer. So as a result of that, we developed a range of prototypes, and we worked with 23 customers over 5 testing rounds, and 2 customer segments, but we were able to work with customers through our NGO partners who had low levels of literacy and numeracy or might have been experiencing homelessness as well, and financial disadvantage. So they were all parents, they all were drivers, and hadn't received a fine of this type before, but we were able to hand them prototypes and see if they could actually use those and work their way through it. This is just one example of a prototype we handed to a group of customers, put it in a window envelope, and without any context handed it to them to see if they'd be able to understand that. So that's the benefit of this type of research. It's really deep insights, quite different to the statistics that I've been really enjoying seeing the last day or so. But this is really about qualitative, deep, contextual information based on the needs of the customers. In some cases, we had babies on the laps of mothers while they were reading this, which made their task more difficult. But as you can imagine, that's the context in which a lot of people are going to receive our notices. So our key findings divided into 2 groups. This one is for all of the customers, or findings related to all customers. So we found, exactly as Greg said, that the safety message was the most critical one for the people that we tested with. So we tried different versions, the safety message versus the statistics on safety, on the financial cost of living impact of the fine and the fact that you would get a caution or a warning. And the safety message, the statistics around safety, every time elicited an emotional response and was more likely to motivate that person that was looking at it. We saw that customers would prefer to self-validate the activity. So I've got my car seat installed. I want to tell Revenue that I've done that and give you proof. I don't necessarily trust the installer to tell you. Fines feel official, and so must our proof of a caution or warning. So we found that it would be absolutely imperative that we issue something that felt formal, not just an email to that person, so that they were reassured that their fine had become a caution. Specifically for customers experiencing hardship, we found hardship customers won't always identify with a hardship program or that they themselves are in hardship, so this really should be a universal program. Human support will be needed, especially when entering the service. We might need to explain the concept of diversion and the pathway towards getting that caution, and that's important for our frontline staff. Many people would struggle to pay upfront for the diversion activity, so it's around $50 to $60 for an installation. Even though that's much cheaper than the fine, there are some people in such extreme financial hardship that they might put their fine through to the work and development order program rather than because they can't afford that installation. So we need to think about how we provide access to the program. Ability to access the actual installation is really important, so we're going to need to think about how everyone across New South Wales can access an accredited car seat installer. And we need to make sure there's lots of channels for more chance of contact. At Revenue New South Wales, we have an outreach team that goes into communities to work directly with people. That will have to be a key function of that program as well. So hopefully you found this quite interesting. We, being a conference of researchers and academics, which neither of us are, we wanted to make sure you knew that we're aware that we know the diversion is not necessarily the reason that those car seats were installed, but it does give us confidence that that safety issue has been fixed for those people that do it, which is really important to us. We don't know exactly why customers didn't take up the diversion. The ones who didn't were really hard to reach. And so we don't know what made up that choice, but we would like to know more about that as part of a pilot and proper evaluation. And we now have a good idea, thanks to the design research, of the aspects of the service that we'll need to put in place. But we'll need that field pilot to further test the approach and to iterate. So for Revenue, we're now really excited and motivated by the success of this fines diversion. We're thinking about how we can scale this up and now put this into place, but also thinking about other fines that might be relevant for this kind of approach as well. So that's where I'd put it out to the audience to please keep the lines of communication open if you have some ideas.
So this wasn't just a proof of concept for child restraints, it was a proof of concept for us for the process. So by the end of the year, we are starting a similar program down in the Macarthur area and moving it to some rural areas as well for just youth, young drivers, so 17 to 21-year-olds, because they're also disproportionately affected by fine. And a quick example, you live at the Oaks, about 30 minutes west of Camden. You're a young P1 licence holder, you've just got yourself a trade, you drive a nice ute, and you need to drive for about 45 minutes to get to a job site every morning, and you get stopped for an under 10 speed. P1 licence holder loses their licence for 3 months. That kid loses his job, he loses his apprenticeship, he stays at home and becomes unemployed instead. So they're the target audience that we're trying for the next one. Watch this space, we hope to grow it, and over the next 12 months we'll be running it. It's great that we've now learnt that we need to involve Revenue a lot earlier so that we can capture the statistics and certain information as we go, rather than trying to back capture it as we did with the child restraint one. So we should be able to get some really good data out of that over a 12-month period, and with a focus on road safety, not punishing our drivers. Thank you.
All right, we have time for a couple of questions. If you could just wait for the mic before speaking.
Thanks very much for that presentation. Alexia Lennon from Queensland Corrective Services. I used to work in the area of road safety research, so this was one of the areas I was quite interested in, was child restraint use more than fitting, but had a lot to do with Kids Safe in Queensland, who do child restraint fitting and other safety, injury prevention type efforts. One of the things that, when I had my son, that was an issue was the cost of child restraints. So although you're talking about the difference between a fine, some hundreds of dollars, and the fitting cost, which is, as I think you said, $60, it's the cost of the restraint that would be one of the major things that would be a barrier to complying with legislation, particularly because parents will use that first restraint, the rear-facing one, and if it's a convertible, they'll use it till the child grows out of that, and then it becomes an issue for them of what's the next restraint we buy. And is that something that we can afford, and is it something that we'll be able to, use for a longer duration, because it's now, you can now get those restraints that take a child up to the age of 7 or 8 when they begin potentially to fit the seatbelt. So how is that being addressed in terms of your program? Because I can see it being a major issue.
Yeah, so interestingly enough, it was Kids Safe New South Wales who travelled all over the country with me doing that Aboriginal program. So any authorised installer west of Dubbo was someone trained by Kids Safe and myself in installation. I know that the WDOs would be available for the installation costs. We run other programs where we help people purchase car seats. I don't know whether WDOs will be available for the purchase price. I know that the NRMA is lobbying the government to try and have funds available by a voucher system on the birth of a child. All I can say is that a fine is $365 and came out and sells a compliance seat for $120. So they're the options, but the $120 isn't available as a WDO. We do, as I said, we do run other programs. In terms of the 0 to 4 car seats, we're hoping that the behaviour will be addressed in that 4 years. So when the child graduates to the next seat up, it's already implanted in the driver and the mum and dad's mind that they have to follow the child up with a compliant car seat. But those costs for the initial layouts, I don't have answers to those questions.
I'll just say one thing. So yeah, exactly what you said is what came out of that research, that we did that design piece after the proof of concept results came through, and that we need to run there's another project that we've got to run to address those issues. So that affordability issue, what do we put in place to help those people who can't afford, but also that access issue as well. So how do we make sure that everyone has equity of access to those installation points as well?
Okay, sorry, if I can take up just a moment more of your time. One of the other related issues is that when you have more children and more car restraints than you have space for in the car, because if you've got a child who's turning from that rear-facing restraint into the next restraint, can you fit a rear-facing restraint and 2 other restraints into your rear seat? And if you have another child, a 4th child, what do you do with that child? And, you know, in those larger families where money really is a huge issue, those vehicles are often being used in that way because they can't fit the number of child seats in, so they kind of don't try. But is that a focus at all in the near future?
I mean, not that specifically, to be honest, but, you know, I think what we're really trying to focus on here is catching those people falling through the cracks of those other programs where there is more of a sort of prenatal, postnatal approach with midwives who are, offering car seats, the Aboriginal programs that Greg's talking about where car seats are actually being handed out, but there's always going to be a group of people who fall through those cracks. And that's where we're trying to use the fine system to identify people who really do need a bit more support to comply with the law.
Peter Johnston from the local court. You raised the issue of people who lose their livelihood because they can't drive to work when their licence is suspended. I just can't see the community utility in people losing their jobs in those circumstances when perhaps there could be some discretion to allow people to at least have a limited licence to be able to drive to work in appropriate circumstances.
So I think for me, diversion programs and cautioning programs need a road safety outcome. We can't just give out a caution or a diversion without achieving that. The young person program will be very similar to the traffic offenders program, but be focused around young drivers rather than all drivers. And we're hoping, as the child restraint program is designed for people who fall through the cracks of education and training for correct installation of car seats, one of our main focus groups is going to be the kids who left school before year 11 and 12, when the education curriculum puts a lot of road safety messages out there for them. So, yeah, look, we've already introduced cautioning buttons for our Mobi poles, which are our automatic ticketing machines that we carry around with us. This program that we're going to look at for youth diversions will fill the gap between those minor cautions that we'll give on the run and the stuff that you'll see before you in the court, sir. And they won't just be given a caution on the run, they'll have to come to some sort of education session so that their road safety outcome's achieved.
Unfortunately, that's all the time we have for questions. If you could join me in thanking our presenters.
Thank you.